Hello, my name is Terri Gorman. I reside in Indiana, and I have a private practice in Knightstown, Indiana. I'm an licensed occupational therapist by trade, and I've done that for over 23 years. I'm also currently in the process of my technique certification with Upledger International. I recently had the opportunity to facilitate processes for a client who did seek services from me for severe headaches related to 2 concussions that he had had. I like to use objective assessments in my practice in order to help the patient to track progress and outcomes, which I use those tools about 80% of the time with my clients. When this particular client came to see me, he had suffered from pain from his headaches for over 5 years, and he had pain approximately 90% of the time, which interrupted his sleep. So he had poor sleep patterns, a lot of pressure in his head, lots of problems with his sinuses, a lot of those types of things. Some dizziness was reported. And we began treatment, and after the 3rd treatment session, he reported that he had had a decrease in his pain symptoms approximately 50% of the time. Prior to that time, he had sought out the services of many different types of medical professionals, had MRIs and CAT scans and many different types of things, and had obtained no type of relief, despite the fact that he took multiple pain relievers and Dramamine and various sleep aids, things of that nature. And he had reported to me that his quality of life was just barely worth living at that point. So now he had a reduction about 50% in his treatment, and in his pain. And so after the 5th treatment session, he was now down to having his pain and other negative symptoms reduced by about 90%. So he decided that he wanted to take a break for a few weeks and kind of see what happens. So when he returned to see me, his pain had now been decreased by about 75%. So he'd had a little bit of an increase again, and he still continued to report pressure in the area of his left sphenoidal area, where one of the insults of one of the concussions had occurred. So we did another 2 to 3 treatments, and after that, he reported to me. He came back and he reported that he was now having no pain. The pressure was gone. His sleep patterns had increased. He had greatly reduced his use of any types of pain medications and no more Dramamine. And he stated to me at that point that he felt like the world needs to know about craniosacral therapy. And he said to me, I would be willing to speak to anyone that you would like to refer to me so that other people can find out about the healing modality of craniosacral therapy. Because I did seek the services of so many other medical professionals who were unable to help me, and I did not get my symptom relief until I came to see you and received this treatment. He then decided at that time that he would go ahead and continue seeing me about once a month for better health and wellness.